Always wanted to be a doctor. I grew up in England. You have to make that decision very early in England. And so I kind of held off making that type of decision because I didn't think I wanted to do the hard work. I came to the US and I actually met a doctor who kind of sort of ignited that interest once again. And he introduced me to some of his orthopedic friends and it kind of went from there. Hi, I'm Andrew Old. I'm an orthopedic surgeon here at Penn Medicine. I'm a joint replacement doctor. I see people with all forms of arthritis to their hips and their knees. And ultimately, if the arthritis is bad enough and it doesn't respond, then perform hip and knee replacement. First encounter, I like the patient to sort of feel comfortable that they're here and they've got some time to talk to me. They've taken time out of their day to make an appointment to come see me. I like to think that I can give them my time and actually listen to them. They come in with a story like this and you've kind of got to get it down to a diagnosis. The reality is we spend most of our time telling most people they don't need an operation, or at least not yet. Back in the day, there was almost like a little black box that the doctor kind of had all the knowledge and the patient kind of didn't have any. That's not true now, right? People can get lots of information. The hard part is knowing what information is accurate or helpful or that it applies. And it's your job to be able to guide them through that, whether it be conservative treatment, weight loss, oral medications, all the way through to surgery. Penn Medicine's this massive entity with a great reputation. It's great to be a part of such a big and successful entity in trying to be not always just cutting edge, but provide really good care. Obviously, technology is rapidly progressing and we don't do much these days that doesn't involve either a computer or a robot or some form of technology. Everybody's got this sort of vision of what robotic intervention looks like. Really, it's a fancy way of measuring. It doesn't replace surgical skill or experience. The robot's not telling you the answer. You're giving it accurate information and then it's helping you to either rotate components or change angles to make a well-balanced knee that is going to feel good for the patient. The best part of my job is most days I get the chance to go in, and whether it's in the operating room or if it's in the office, I get to listen to a person's problem and then try to fix it. Your motivation every day is to go in and you can help somebody else's life. I mean, that's pretty cool.